Amref, together with the Ministry of Health in Kenya, brought together governments from across the continent, funders of global health and health in Africa, civil society organizations, and health workers, and also parliamentarians to discuss the issue of how Africa can achieve fit-for-purpose health workforce.
Any healthcare system spends close to 60-70% of the total health expenditure on health workforce in terms of wages, allowances, stipends.
Africa will continue to face significant challenges related to our health workforce, which encompasses planning, production, absorption, optimal investment, retention, and development of our health workforce.
For us, for Malawi, the issues are the same. I think first and foremost, it is issues about health financing. Already as a health sector, we are not able to reach even the Abuja declaration of having 15% of the national budget going to health sector. All of us, universal health coverage, it means we need to provide services everywhere in our countries, but we're unable to do that because we're unable to retain the health workers which we can employ.
When we are looking at the human workforce, we need to look at the workforce from the community level up to the tertiary institution. There is need to have a very good workforce, either in the form of community health workers or village health teams or whatever within the communities that can give first-hand help to the people within the communities, identify them, and link them to the hospitals. And such a workforce also needs to be trained and equipped and guided, because we need data from the communities, and such data informs planning for the broader workforce.
And the Minister for Uganda said that the health workers must actually think of the welfare of people first, but they must be alive when they are thinking of the welfare of others. So we are going to have that immigration and movement, whatever we do. That also will need legal provisions on international movement of the health workforce.
We have to recognize that migration today is at the highest ever levels of the data the WHO has collected. In the last 3 years, we've seen an 80% increase of migration to high-income countries in those countries that are reporting to OECD and WHO. We must talk about it. Africa is the region that we have to really, really, at a global level, support with the multilateral partnerships that is necessary to protect your workers, to protect their working conditions, to protect the investment that you have in the budgets today against any economic downturn, against any demands that are, parliamentary demands for let's invest in education, let's invest in infrastructure, let's invest in digital, make sure we still invest in health no matter what we do.
It is very important that those of us who are in parliament understand the need and can lobby for more investment. So I think it's important for people like us to hear what is happening to our ministers when they are looking to achieve universal health care.